History. Try to get a history from those around. Mechanism of the incident and injury. Previous medical history. Current medications and allergies. Observation on the weight of the athlete while putting on gloves. Environmental factors. Weather, field hazards, equipment. Body position. Patient on ground with arms raised above head may indicate spinal cord injury. Severe bleeding, gross deformities, skin color. At the athlete, check for consciousness. If unconscious, send someone to activate EMS. Note the time. Primary assessment. Remove helmet. Check for send to life. Look, listen, and feel for breathing for 10 seconds. Get AED. Run rescue ratio of 30 compressions to 2 breaths. 100 to 120 compressions per minute. 2 rescue ratio of 30 compressions to 2 breath. Switch when AED analyzes rhythm. Alert 911, CPR/rescue breathing in progress. Life-threatening bleeding. Check for severe bleeding. Control with direct pressure and pressure points. Brachial and femoral arteries. Spinal injury precautions. Stabilize/mobilize neck/head. Get if assistant present, then have them stabilize neck and apply cervical collar. Log roll and spine board the patient if qualified assistant present. Coordinate with EMS. List signs and symptoms of shock. Pale skin color, cool clammy skin, weak and rapid pulse, shallow and rapid respirations. Pupils may be dilated when in shock. Blood pressure may be falling. Red heat stroke, pale blue hemorrhage. Taken vitals, level of consciousness, pulse, blood pressure, respirations rate and depth. Skin temperature and appearance. Pupils, pearl. Pupils equal and reactive to light. Secondary assessment, head to toe. History. Where does it hurt? Do you have pain in your neck? What happened? Did you hear or feel anything? Do you feel any numbness or tingling sensations? Do your hands wiggle fingers? Can you move your feet, wiggle toes? Orientation. Check level of consciousness. Ask who, when, where, and what were you doing? Head to toe survey. To quick check for obvious signs of severe injuries. Bleeding, fractures, deformities, edema. Look for normal to see abnormal. Head. Scalp. Eyes, ears, nose, and mouth. Blood, CSF. Cervical spine, check in nose and nose C-collar. Point tenderness, dislocations, abnormal alignment. Thoracic and lumbar spine. Point tenderness, dislocations, abnormal alignment. Trunk, clavicle, shoulders, chest. And movement on both sides equal, normal rise and fall. Rib compressions test, crepitus and false and normal movement. Abdomen, check for quadrants and rigidity. Tenderness and rebound tenderness. RUQ, liver, gallbladder, colon, right kidney. LUQ, stomach, spleen, referred pain to shoulder, Kerr sign. Pancreas, colon, left kidney. RLQ, colon/intestines, appendix, and Bernie's point, ureter. Females, ovaries, fallopian tubes. LLQ, colon/intestines, ureter. Females, ovaries, and /fallopian tubes. R/LLQ, bladder, females, ureter. Ureter. Pelvis, compression test, fracture, outward rotation of hip and appears longer than common sign. Dislocation, leg appears shorter and inwardly rotated with knee flexion. Legs and feet, check for fractures and bleeding. Check dorsal pedal or posterior tibial pulse bilaterally. Check motor response. Plantar and dorsiflex feet bilaterally. If unconscious, scratch foot. Babinski's response. Great toe extended and others splayed. Equals motor neuron lesions. Check sensation. If it's unconscious, scratch each arch of foot. Arms and hands. Check for fractures and bleeding. Check radial pulse bilaterally. Check for motor response. Squeeze fingers bilaterally. Check sensation. If unconscious, scratch each palm. Recheck vitals. Level of consciousness. Pulse, respirations, blood pressure, skin temperature, and appearance, pupils, and pearl. This concludes the primary and secondary survey. I now have a better understanding of the specific injury. I would maintain the airway and continue to perform rescue breathing and or CPR until relieved by qualified medical personnel. I would control bleeding and splint fractures, treat for shock, check vital signs every 5 minutes, and monitor level of consciousness constantly. I would then refer my patient to a physician as needed. God bless.